Hi doctor friends, welcome to my YouTube channel PG Dr. INDRANJU. Today's discussing topic is about the classification of anti-arrhythmic drug. The first of all, start with anti-arrhythmic drug. Something brief review about the arrhythmia is that the what is the arrhythmia? Arrhythmia, that means when the normal heartbeat or rate are maintained, then it is normal condition. When the heart rate more than 100, it is called as tachycardia. Tachycardia. And below 60 is called bradycardia. And this is the condition of tachycardia and bradycardia, and 60 to 100 is normal. 60 to 100 beat per minute is normal condition for such. Arrhythmia called when the rhythm and velocity of conduction of impulse is altered, then this is called as arrhythmia. So arrhythmia maybe, if you look, it is heart, it is atrium, it is ventricle, it is right atrium, right ventricle, left atrium and left ventricle. This is the division point when atrioventricular septum, and above this is known as supraventricular part, and below that are called as ventricular part. And many times this is arise that what is the supraventricular tachycardia, ventricular tachycardia, tachyarrhythmia. This is the condition of the condition of atrial, and arrhythmia is generated in case of atrium or ventricle is due to extra rate. If the foci are generated, electric impulse are generating some other place or other than SA node is generating impulse, extra impulse are generated, so it causes supraventricular tachycardia. This is generally brief review about the arrhythmias. So we have to focus on main topic, the classification. The classification of anti-arrhythmic drug, this is divided into 5 types. This is based on this division of anti-arrhythmic drug are by the Singh-Vaughan-Williams classification. The classification start with class 1, class 2, class 3, class 4 and class 5. Class 1 are sodium channel blocker, class 2 are beta blocker, class 3rd is potassium channel blocker, class 4 is calcium channel blocker, and class 5 are other mechanism action. So these are categorized on class 5. Start with class 1st. Class 1st is membrane stabilizing agent and sodium channel blocker. Further division of the class 1 is class 1A, class 1B, class 1C. Class 1A also acts moderately, so named as moderate acting or intermediate acting sodium channel blocker. In that, the drug are procanamide, quinidine, and disopyramide. And based on this classification, these are anticholinergic drug. And anticholinergic, procanamide is weak anticholinergic drug, while that of quinidine is moderate acting anticholinergic drug, while that of disopyramide is a strong anticholinergic drug. And this is used for atrial fibrillation, atrial flutter, supraventricular tachyarrhythmia, and ventricular tachyarrhythmia. This is for class 1A. Then focus on 1B. It is rapid acting or weak acting. Due to rapid acting, it is weak acting named, and the drug in that is lignocaine or lidocaine, mexilatine, phenytoin, and tocanide. The lignocaine is IV drug, while that of mexilatine is oral lignocaine analog, and tocanide is oral lignocaine analog, used for ventricular tachyarrhythmia. Next is first C, is slow acting or strongest acting. In that includes flecainide, propafenone, morisizine. Flecainide are used for supraventricular tachyarrhythmia. Propafenone is used for ventricular tachyarrhythmia and supraventricular tachyarrhythmia, while that morisizine used for ventricular tachyarrhythmia. This is used for life-threatening supraventricular tachyarrhythmia and ventricular tachyarrhythmia. Next is the class 2 drug. Class 2 drug includes beta blocker, and in beta blocker there are many drugs used for, such is carvedilol, propranolol, esmolol, metoprolol, nebivolol, and sotalol. It is also included in the class 3 drug. Sotalol have function of class 2 and class 3 drug. Next is the class 3 drug. Class 3rd is which are acts on potassium channel blocker. Amiodarone, bromelain, dofetilide, ibutilide, and vernaculant is the drug which are included in the class 3. If we talk about the amiodarone, it is also weak class 1st, 2nd, and 4th. That means amiodarone are included in all 4 classes, but it is class 3 drug mainly, while that of it is weak class 1, class 2, and class 4 drug. And ibutilide are used for mainly atrial flutter. So if we talk about the uses of class 3 drug, it is in the Wolff-Parkinson-White syndrome, ventricular tachyarrhythmia, atrial fibrillation, and atrial flutter. Then we are going to talk about the class 4 drug. Class 4 drug work as calcium channel blocker like verapamil and diltiazem. This is used for proximal paroxysmal supraventricular tachycardia and decreased ventricular rate when the patient with atrial fibrillation. And next is class 5. Class 5 drug used for AV nodal inhibitor. Under this categories, the drug are adenosine, magnesium sulfate, digoxin. These are used for supraventricular tachyarrhythmia, not in ventricular tachyarrhythmia. This is the classification of anti-arrhythmic drug. Thanks for watching my video. Have a nice day.